Assalamualaikum warahmatullahi wabarakatuh. Let us introduce ourselves. My name is Nadia, and this is my partner. Please introduce yourself, please.
Hi, my name is Nurlita.
In this video, we are going to demonstrate a debate by using British parliamentary debate. Our motion is school closures are necessary to prevent the virus COVID-19. My partner, Nurlita, as preposition or government side, and I as opposition side. Okay, Lid, are you ready to start our debate?
Totally ready. I'm ready to win Nad.
I'm also ready to beat you, Lid. Okay, because both of us are ready, let's start our debate. Let's start, Lid.
Okay, thank you, Nadia. I, as the proposition side, agree that school closures are necessary to prevent the virus COVID-19 because three are a lot of reasons that can support my statement.
But I, as the opposite side, don't agree with your statement. I think school closure are not necessary to prevent the virus COVID-19. You say that you have a lot of reason to support your statement. So, what is the reason or data that can support your statement?
Oh, research in Wuhan, the city in China where the outbreak first emerged, suggests closing schools could reduce the spread of the virus by 14 till 16% and delay the epidemic spread. A study exploring how changing contact patterns have shaped the dynamic of the COVID-19 outbreak in China was recently published in Science magazine. The study examines the impact of aggressively implement social distancing measures and school closures to stop transmission in Wuhan and Shanghai. Although children are much less likely to become infected, their high contact rate makes them possible factor or intermediaries. If school remained open, children would have about three times as many contacts as adults and three times more chance of being infected. But school closures could potentially reduce it by 14 till 16%, the study said. Research developed a model to estimate impact using data on how often people interest and where. They analyzed contact survey data for Wuhan and Shanghai before and during the outbreak and track contact information from Hunan province. Daily contact was reduced by 7 till 8 times during the COVID-19 social distancing period, with most interactions confined to households.
Okay, thank you for your statement, Lid. But now I'm going to replay your statement by the data that I have collected. I don't agree with your statement that closing school can reduce the spread COVID 40 until 60%. So I'm going to tell you about the data. Data showing that closing school doesn't guarantee prevention of COVID-19. Data from countries that have closed school to slow the spread of COVID-19 shows that school closures are not a panacea as some believe. Australia became a country that didn't close schools. One of the reasons schools in Australia haven't closed is because school-age children are a relatively unaffected group by the virus. And also, Taiwan, the spread of COVID-19 was minimized without widespread planned school closures. According to a model from the United States Center for Disease Control and Prevention, CDC, there is no evidence that Hong Kong, which closed school, was more successful at containing the virus than Singapore, which didn't. And also, data from the SARS outbreak in mainland China, Hong Kong, and Singapore suggests that school closures didn't contribute to the control of the pandemic. Recent modeling studies of COVID-19 from the United Kingdom using data from Wuhan, China outbreak predicted that school closures alone would prevent only 2% to 4% of deaths, much less than other social distancing intervention.
Okay, you said that school-age children are a relatively unaffected group by the virus. But we cannot ignore the fact that the interaction that could happen in school between adults or teacher and student. It is possible that students would travel to school and interact with other children and teachers can actually increase the spread of COVID-19. And also children like awareness of COVID prevention, such as washing hands, wearing masks, or keeping a distance.
Uh, okay, but don't you know that closures school even more increase the spread of COVID-19? I will give you the data by many aspects. The risk of spreading the virus is higher. For example, if parents must work and grandparents must become the primary uh, caretakers of children, the risk significantly increase, and these parents who are perceived at the greatest risk of serious illness may become infected. And this is what happened in Italy in the first 2 weeks when school closures was decided by other works activities were not stopped. And this and also, the other aspect, for example, is economy. The potential negative consequences of this measure cannot be ignored. Some consequences regard the family to take care of the youngest children when daycares and school are closed. Parents might remain at home with inevitable economic consequence. And also, there is also the other aspect, for example, is medical effect. In addition, when parents are healthcare workers, this can have relevant medical effect. In the US, it has been calculated that the absence from work of 15% of healthcare workers may be associated with a significant increase in COVID-19 mortality. So here's the thing, closing school entirely could also impact the ability of health workers to provide medical care when it is most needed in COVID situation. And also, here's the thing, for example, if you have a school where a large number of parents are health workers and they have to take time off to take care for their children, then intensive care units can end up under a lot of moral pressure. Now, I'm asking you, what is the data that you can show that closer school is necessary to prevent COVID-19, because what exactly happened is otherwise. For example, that I already said to you.
Okay. Research from the Norwich-based University of East Anglia also found closing schools was one of the most effective methods of controlling the virus. The study refers to the success of implementing social distancing in 13 European countries. Closing schools in Europe is the most effective intervention to control COVID-19. The conclusion, I believe the
Okay, I think because we have debate for about 10 minutes, I think now we have to move on to conclusion. So you as proposition side can give your conclusion about the motion.
thank you, Nadia. I will be to conclusion. I believe that closing schools is very necessary to reduce the spread of COVID because because the unavoidable number of interaction in school can cause the risk of spreading COVID-19 to be higher.
Okay, thank you for your conclusion, Lita. Now, I'm as a proposition as opposite side will give my conclusion. I believe that the method of closing school to reduce the spread of COVID is very ineffective because many factors such as the economy, health workers, and the interaction of children outside other in school can actually make the spread of COVID even higher. So that's the end of our debate. Um, uh, we are going to ask to Mrs. Azmi who will watch our video to to be judged who is the winner. So thank you, Lita, uh, for to become my partner today. So that's the end of our debate. Hadanallah wa yakum mustaqim. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Most
Okay, bye
welcome, Nadia.
Lita. Have a nice day.